breast cancer is most often found in women, but men can get breast cancer. About 1 out of every 100 breast cancers diagnosed in the U.S. would be in a man.
Yeah, and the most common kinds of breast cancers that are found in men are the exact same common kinds that are found in women. That's all according to the CDC.
Joining us now to talk more about this is Dr. Celeste Reese-Willis. Good morning, Dr. Celeste.
Good morning. Happy Monday.
You too. Let's jump right into this. So what are some of the risk factors for men with breast cancer?
Well, the first risk factor, obviously, is having a family history of breast cancer. Those men are at higher risk of getting breast cancer. Having an older age, breast cancer is typically diagnosed in men that are over 50. They're actually closer to being 67 in their 70s, most men, when they're diagnosed. In addition to that, being exposed to estrogen, having liver disease puts you at increased risk. Being obese or overweight, obese men carry a greater risk factor for breast cancer than those men that are of a normal weight. Having a history of Klinefelter syndrome, and this is a syndrome that deals with the abnormal development of the testicles. Having any kind of testicular disease or surgery puts you at increased risk, in addition to being positive for BRCA1 or BRCA2 gene mutations.
Now, Dr. Celeste, let me ask you this. Are people basically, do they encounter estrogen in just like over-the-counter situations, or do they know that they are being exposed to estrogen?
So these are people that may perhaps have had to have a hormonal treatment. They're actually hormones that we use to treat prostate cancer. So these people may be exposed to those for that reason. There are also changes that people choose to make at this time when they're taking estrogens because they are trying to, it's a transgender person that's trying to do a sex change or an operation. So that greater exposure to estrogen puts them at greater risk of getting breast cancer.
Gotcha, gotcha. Okay.
What are the symptoms of breast cancer in men? What do they need to look out for?
Very similar to what we find in women. You're going to be looking for, guys, a new lump or bump that's in your chest area, under your arms. So please check any thickening or swelling or of any part of the breast, any change in the size or the shape of the breast, any kind of irritation or redness or flaky skin near the nipple area. You can also get a dimpling or a pulling in at the nipple area, as well as nipple pain. Having a nipple discharge that's anything other than breast milk would also be something indicative and concerning.
Anything preventative that men can do to reduce their risk?
Absolutely. One of my favorites, you guys know I love it, exercise routinely. Being physically active helps to decrease the risk of cancer. You want to limit your alcohol intake. In addition to that, avoid obesity or being overweight. If you know that you're overweight, let's do something about it now. That increases your risk of breast cancer. And then, of course, following a diet that's high in natural fruits and vegetables and avoiding processed foods.
Dr. Celeste, thanks so much for breaking that down for us this morning.
Have a great day.